going to be performing my enema skill. Please excuse my attire. None of my lab coats or anything fit anymore so late in my pregnancy. The first thing I'm going to do is check the physician's orders and make sure I'm doing the correct procedure, which I am. I'm going to be doing enema by bag. And I'm then going to check my patient's 5 rights, which is drug, route, patient, amount, and time. And I'm going to then go back and get set up for my procedure. So first thing I'm going to do is fill my bag. And I want the water to be warm, so about 100 to 105 degrees would be sufficient. We don't want the water to be cold and very uncomfortable. And I want my tip to be lubricated. This tip is pre-lubricated, and if I need some more, I can always add some, but there should be enough. I'm going to don my gloves. And with the water in the bag, I'm going to, while my patient is in left sims, I want to make sure all the air is out of the bag. So I'm going to unlid and unclamp. And I'm just going to roll the extra air out of the tubing and out of the bag. I want to make sure the patient gets the right amount of solution that's ordered, so I don't want to do too much. And then again, I'm going to clamp the bag back. And with my patient in left sims, with the bedpan near to catch extra fluid along with the chuck. As the patient's slowly breathing in and out, I'm going to insert the tubing into the rectum. About 1.5 inches, 2 inches. I'm then going to unclamp the tubing and hold the tube in place, and I'm slowly going to roll up the bag. I want to make sure that the patient is getting the solution that's needed for the procedure. And I don't want to put it in too fast because it would be very uncomfortable. But so put it in there enough so that it helps to irrigate out that bowel. I slowly roll it in. Make sure I get all the fluid in there. I'm going to then remove the tubing slowly and roll my patient on top of the bedpan. And I'm going to dispose of the enema and my gloves in the correct receptacle. So into the garbage. Then remove my gloves into the garbage. And my patient is draped and has complete privacy. It's hard to show with a couple of rolled towels. But I will let my patient sit there for a few minutes to try to get the bowel out and with the collate. And I'm going to go sign off that I did the procedure, and then I'm going to come back and check on my patient. And then I'm going, after the patient, I have product. I'm going to note the amount, the color of the bowel, and chart on that. And that is the enema procedure.